silent, deadly, and invisible. These three words aptly capture the nature of blocked arteries, one of the most perilous health conditions that millions are harboring within their bodies, completely unaware. At this very moment, your own arteries could be gradually narrowing, starving your heart, brain, and limbs of the essential blood flow they need to function. In the United States, a life is lost to cardiovascular disease every 36 seconds. The most shocking truth, however, is that a majority of these deaths were likely preventable had the individuals involved recognized the early warning signs. Tragically, your body is in a constant state of sending out distress signals about these blockages, but these signals frequently disguise themselves as common, everyday discomforts that we tend to brush aside or disregard entirely. That uncharacteristic fatigue you've been feeling, the mild shortness of breath when you climb the stairs, or the cramps in your legs when you walk, these are not just indications of aging. They could be your body's urgent pleas for help, warning you that something is critically wrong within your circulatory system. Before we get into these vital warning signs, if you're just joining our channel, we welcome you on this path to improved cardiovascular wellness. Please hit the subscribe button and click the notification bell to ensure you don't miss any of our life-saving information. Your heart will be grateful. Also, let us know in the comments which country you're joining us from. We enjoy connecting with our worldwide community of health-focused individuals. Today, we are bringing to light 10 crucial indicators that your arteries may be perilously blocked. These are not simply small annoyances. They represent potentially fatal symptoms supported by extensive research from esteemed medical institutions such as the Mayo Clinic, the Cleveland Clinic, and UT Southwestern Medical Center. The information you are about to receive could genuinely mean the difference between identifying a problem in its early stages and confronting a medical crisis that could tragically end your life. Let's now examine the warning signs of blocked arteries, starting with the very first one. 1. Chest discomfort or angina. The primary warning sign is discomfort in the chest, known in medical terms as angina. The danger here is that this sensation doesn't always manifest as the theatrical, chest-clutching agony depicted in films. A great number of people characterize it more as a pressure, a tightness, a squeezing, or a dull ache in the chest. According to research from the Mayo Clinic, this discomfort is, quite literally, your heart muscle crying out for more oxygen at a time when the coronary arteries have become restricted due to plaque accumulation. The underlying mechanism is both captivating and alarming. Your heart muscle depends on an uninterrupted flow of oxygen-rich blood to operate. When plaque builds up inside your coronary arteries, it acts as a bottleneck, impeding blood flow. During periods of heightened demand, such as when you're climbing stairs or under emotional duress, your heart requires additional oxygen, but the constricted arteries are unable to supply it. This pain doesn't always remain isolated to the chest either. It has the potential to radiate outward, like malfunctioning electrical signals, extending to your arm, most notably the left, neck, jaw, back, or the upper part of your abdomen. This pattern of dispersal happens because your heart shares nerve pathways with these other body regions. Typically, angina emerges during physical exertion when your heart's oxygen needs increase and then eases with rest as the demand lessens. This predictable cycle often deceives people into believing it's merely fatigue or a muscle pull, when in fact, it is your heart's urgent distress call. 2. Shortness of breath. Unexplained shortness of breath is not the same as the expected breathlessness following vigorous exercise. It is the feeling of being winded during activities that you previously handled with ease, or in some cases, experiencing a lack of breath even while you are at rest. This symptom is especially treacherous because it tends to develop slowly, which makes it easy to dismiss or rationalize. When your arteries become obstructed, your heart has to work much harder to pump blood effectively through your body, leading to a dramatic drop in pumping efficiency. You can visualize it as attempting to water your garden with a hose that has a kink in it. Regardless of how hard the pump works, an insufficient amount of water reaches the end. This means your tissues are not getting the optimal supply of oxygen, and your body tries to compensate by making you breathe faster and more deeply in a desperate attempt to pull more oxygen from the air. Mayo Clinic research suggests that dyspnea, or shortness of breath, is frequently one of the first indicators of heart failure, which often stems from long term arterial blockages that have progressively weakened the heart muscle. As your heart becomes weaker from constantly fighting against these obstructions, its pumping becomes less efficient, which can cause fluid to back up into your lungs. Women, in particular, should be attentive to this symptom, as studies show they are more likely than men to experience shortness of breath as the main sign of heart disease, rather than the classic chest pain more commonly reported by men. 3. Dizziness, lightheadedness, or sudden nausea. This combination of symptoms often points to a reduction in blood flow to the brain caused by blockages in the arteries. When the arteries that deliver blood to your brain or heart become restricted, your body has difficulty maintaining an adequate supply of oxygen to your vital organs. Dizziness emerges when your brain is deprived of enough oxygen rich blood, leading to that disquieting sensation of spinning. Research from UT Southwestern Medical Center indicates that these symptoms frequently appear together during cardiac incidents because they are triggered by the same underlying issue: decreased cardiac output resulting from obstructed coronary arteries. When your heart is unable to pump efficiently, it struggles to sustain proper blood pressure. The sudden onset of nausea is especially noteworthy. Your digestive system demands a significant amount of blood flow, and when your heart's pumping capacity is diminished, blood is often redirected away from the digestive organs to ensure a steady supply to more critical areas. Many people incorrectly attribute these symptoms to things like dehydration or stress. However, when they happen in conjunction, they could be a sign of serious arterial blockages that demand immediate medical evaluation. If you experience the abrupt onset of dizziness, lightheadedness, and nausea together, especially if accompanied by chest discomfort or shortness of breath, it could signify an acute cardiac event. 4. Unexplained sweating, fatigue, or cold sweats. Cold sweats are an especially troubling warning sign. In contrast to the normal sweating that occurs from heat or physical effort, cold sweats happen when your body is under extreme stress due to insufficient blood flow to vital organs. When your arteries are obstructed and your heart is struggling to pump effectively, your body triggers its emergency response systems, releasing stress hormones that result in sudden, clammy perspiration. Cardiovascular research reveals that unexplained fatigue is often one of the earliest signs of heart disease, particularly for women. This isn't the kind of tiredness you feel after a long day. It is a persistent, profound exhaustion that does not get better with rest. When arteries are blocked, your heart has to work significantly harder to circulate blood, which eventually causes the heart muscle itself to become fatigued, and this manifests as a feeling of whole body exhaustion. As blocked arteries restrict the flow of blood to your heart muscle, your heart's efficiency declines. To compensate, your heart may beat faster and work harder, but this increased effort eventually tires out the heart muscle. This cardiac fatigue then translates into systemic fatigue that impacts your entire body. It is more common for women to experience fatigue and sweating as their primary symptoms of heart disease rather than chest pain. Many women have reported feeling a sudden, inexplicable exhaustion for several days or even weeks leading up to a heart attack. 5. Pain that spreads beyond the chest. Pain that radiates beyond your chest can create a complex network of discomfort that often confuses both patients and medical professionals. When your heart muscle is not receiving sufficient blood flow because of blocked coronary arteries, the resulting pain does not adhere to neat boundaries. The heart shares nerve pathways with several regions of the upper body, which causes cardiac pain to show up in the shoulders, arms, back, neck, jaw, teeth, or upper abdomen. Research from the Mayo Clinic has extensively documented this pattern of pain radiation. Pain in the left arm is strongly linked to cardiac events, though the pain can affect either arm or both. It is often described as an aching heaviness or a sense of pressure rather than a sharp, stabbing pain. Back pain, specifically between the shoulder blades, is also frequently reported, but is commonly mistaken for a simple muscle strain. Jaw and neck pain can present a diagnostic dilemma because they are often attributed to dental issues or neck problems. However, when jaw pain is accompanied by other cardiovascular symptoms, or when it appears during exertion and disappears with rest, it is a strong indicator of a cardiac origin. The sensation might feel similar to a toothache, but its pattern of behavior reveals its connection to the heart. Upper abdominal pain is perhaps the most deceptive, frequently being mistaken for indigestion when it should be prompting a visit to the emergency room. 6. Leg pain or cramping while walking. Leg pain or cramping that materializes while you are walking and then subsides when you rest is an indicator of peripheral artery disease, PAD, a condition where the arteries that supply blood to your legs have become blocked. This symptom usually presents as cramping, aching, or a feeling of fatigue in the leg muscles during physical activity. While it most commonly affects the calves, it can also occur in the thighs, hips, or buttocks. Research published in the field of vascular medicine has shown that peripheral artery disease is rarely an isolated condition. Experts at the Cleveland Clinic point out that PAD affects over 200 million people globally and approximately 12 million adults aged 40 or older in the US. If you have blockages in the arteries of your legs, there is a very high likelihood that you also have arterial blockages in other critical parts of your body, including your heart and brain. This makes what is known as intermittent claudication a full body warning sign that your entire arterial system is at risk. The mechanism behind this is concerning. When the arteries in your legs are narrowed by plaque, they can provide enough blood flow when you are at rest, but they cannot meet the increased demand for blood during activity. This leads to muscle cramping as the tissues are deprived of oxygen. The pain is typically predictable, appearing at consistent walking distances and reliably easing with rest. Many people dismiss this leg cramping as a normal part of aging, a lack of fitness, or a simple muscle strain. 7. Non-healing foot or leg sores, coldness, or color changes. Observable changes in your feet and legs are a sign of severely restricted blood flow. These include non-healing sores, a persistent feeling of coldness, and alterations in skin color. These symptoms are characteristic of advanced stages of peripheral artery disease, signaling that the blockages in your arteries have reached a dangerous level. When the arteries that supply blood to your extremities become severely obstructed, your tissues do not receive enough blood flow to support normal healing processes and to regulate temperature effectively. Ulcers or sores that do not heal may persist for weeks or even months because the blocked arteries cannot deliver the adequate oxygen and nutrients required for the healing process. Research from the Cleveland Clinic documents that a constant feeling of coldness in the feet or legs, particularly when one limb is noticeably colder than the other, points to significant arterial blockages. Your extremities should be able to maintain a consistent temperature through proper blood flow. When this is compromised, your feet and legs will feel perpetually cold, even when you are in a warm environment. Changes in color provide visible proof of poor circulation. The skin may look pale, bluish, or shiny due to the reduced blood flow, sometimes with mottled patches that indicate an uneven distribution of blood. Hair loss on the legs and feet is another indicator of poor circulation, as hair follicles need sufficient blood flow for normal growth. 8. Erectile dysfunction in men. Erectile dysfunction, ED, often acts as an early detection system for arterial blockages throughout the entire body, frequently emerging years before more apparent cardiovascular symptoms do. The ability to achieve an erection is entirely dependent on having sufficient blood flow to the specialized blood vessels in the penis. Research from the Physicians Committee for Responsible Medicine has firmly established a strong link between erectile dysfunction and cardiovascular disease. The arteries that supply the penis are smaller in diameter than those that serve the heart and brain. This means they often become clogged with plaque before the larger arteries show signs of significant narrowing. Men who develop erectile dysfunction, especially without any clear psychological reasons, have a markedly higher risk of experiencing a heart attack, stroke, or peripheral artery disease in the years that follow. Atherosclerosis does not affect just one location. If plaque is building up in the penile arteries, it is highly probable that it is accumulating throughout the rest of the body, including in the arteries of the heart and brain. What makes this connection so useful for early detection is the timing. Erectile dysfunction frequently appears years before other cardiovascular symptoms become noticeable, giving men a potential opportunity to address the underlying arterial disease before it advances to a more dangerous stage. While many men attribute ED to stress, aging, or psychological issues, the vascular component should never be overlooked. 9. Transient ischemic attack, TIA, or stroke-like symptoms. Transient ischemic attacks, TIAs, or symptoms that mimic a stroke are an indication that the arteries in the brain are blocked or severely restricted, which creates temporary disruptions in blood flow that lead to neurological symptoms. A transient ischemic attack begins just like a stroke, causing stroke-like symptoms such as numbness or weakness, but it resolves within a few minutes or up to 24 hours without leaving any lasting damage. The symptoms are distinct: a sudden numbness or weakness that affects one side of your face, arm, or leg; facial drooping that creates an uneven appearance; difficulties with speech, such as slurred or jumbled words despite clear thinking; trouble understanding what others are saying; and vision problems, including a sudden loss of vision, double vision, or blind spots in your visual field. Research from UT Southwestern Medical Center stresses that these symptoms, even if they completely disappear within a few hours, should be treated as medical emergencies. Approximately one-third of individuals who experience a TIA will go on to have a more severe stroke later on. The temporary nature of these episodes can mislead people into believing they were not serious, but TIAs are a clear sign that the arteries in the brain are severely compromised and a major stroke could happen at any time. 10. The 6 Ps of acute limb ischemia. The most severe warning sign of an arterial blockage is acute limb ischemia. It can be remembered by the 6 Ps: pain, pallor, paleness, pulselessness, paresthesias, pins and needles, paralysis, and poikilothermia, coldness. This condition occurs when an artery that supplies an arm or a leg becomes suddenly and completely blocked, and it constitutes a genuine medical emergency. The pain is severe, comes on abruptly, is constant, and does not get better with rest. It is often described as a deep, burning sensation within the affected limb that gets progressively worse as the tissues are deprived of oxygen. Pallor refers to a pale appearance. The limb loses its normal color and appears pale, white, or waxy in comparison to the unaffected limb. Pulselessness means that the normal pulses cannot be felt below the point of the blockage. Paresthesias involve abnormal sensations like tingling or numbness as the nerve tissues are deprived of oxygen and begin to malfunction. Paralysis signifies a loss of motor function as the muscles and nerves become increasingly oxygen-starved, often starting with weakness and advancing to a complete inability to move the fingers, toes, or the entire limb. Lastly, poikilothermia refers to the limb becoming cool to the touch, as there is not enough blood flow to maintain a normal temperature. These 10 warning signs represent your body's complex alarm system, desperately attempting to notify you of arterial blockages that could endanger your life. From the subtle pressure of angina to the medical crisis of acute limb ischemia, each symptom offers critical information about the health of your cardiovascular system. The tragedy is that the majority of people disregard these warning signs until it is too late. Recognition and prompt action are absolutely vital for survival. These symptoms do not happen in isolation. They often reflect a spectrum of arterial disease that is affecting multiple parts of your body at the same time. If you recognize any of these warning signs, particularly if you experience multiple signs together, it is imperative that you seek an immediate medical evaluation. When it comes to arterial disease, time is literally life. Remember that arterial blockages build up gradually over many years, much like rust slowly forming inside pipes, but their effects can manifest suddenly and with dramatic consequences. The chest discomfort you might dismiss as stress, the leg cramping you might attribute to getting older, or the breathlessness you might blame on being out of shape could all be early warning signs of a life-threatening arterial condition. Don't become another tragic statistic. If this video was helpful, please type "helpful" in the comments. This encourages us to create more content like this. Please like this video if you found the information valuable. Share it with friends and family who need to be aware of these crucial warning signs, and subscribe to our channel for more life-saving health information. Thank you for watching, and thank you for taking your health seriously enough to learn about these potentially life-saving warning signs.